Hi, my name is Jessica Anderson. I'm a nurse midwife at the Center for Midwifery at University of Colorado Hospital. Congratulations on your birth. Today we're going to talk about going home with your baby and also taking care of yourself once you get home. Once you give birth, you will get a folder like this from one of your nurses, and it has a variety of information on how to take care of yourself and also how to take care of your baby. There's also some resources regarding outpatient support group for breastfeeding, and also information about vaccinations, postpartum depression, and things like that. So make sure you get this folder from your nurses before you leave the hospital. There are a number of things you should watch for after you go home from having your baby. There are certain complications that can develop. For example, mastitis, urinary tract infections, and even blood clots are something that some women experience. Please keep in mind that the majority of women do just fine postpartum and do not develop complications. We'll now go over a list of items that you should know and watch for to call your provider if any of these do occur. First thing we're going to talk about are warning signs for mothers. So once you go home, if any of these things would occur, this is a reason to call your midwife or your physician. It is normal to have vaginal bleeding once you give birth, but there are certain things that may occur that require you calling your provider. For example, if you start having blood clots that are larger or having blood clots every time you change your pad, you should call your provider. In addition, if your bleeding gets heavier where you're changing your pad every 1 to 2 hours because it's saturated, that is another reason to call your provider. If your bleeding changes to bright red once it's been a different color like brown, you should call your provider. In addition, if you develop any signs of infection. So this could include foul smelling or odorous discharge from the vagina. It could also include any signs of a breast infection called mastitis, which would be a bright red area of one of your breasts, any warmth or severe pain or fever. In addition, it is also common for some women to develop a bladder or kidney infection. If you have any pain with urination, you should call your provider. If you had a C-section and you develop any redness or pain or oozing of drainage from your incision, if you have any worsening pain on your perineum. So if you've had stitches and the pain had improved and now is worse, you should call your provider. Another sign that is not normal is if you have any visual changes. So if you're seeing spots, double, or floaters. Also, if you develop a fever or a temperature, if you faint or lose consciousness once you get home, you should call your provider. Let's talk about depression. If you develop severe mood changes or swings or have any feelings of hurting another individual or yourself, you should call your provider. Lastly, another reason to call your provider is if you develop any pain in your calves, any redness, any signs of a blood clot, you should call.